You don't want to have to poop if you're running away from a tiger.
But that's the underlying brain mechanism that our bodies go into, right? You're in the middle of a race, you're trying to get away from the tiger. We're in a sympathetic response state. We don't activate our rest and digest. Like right now is not the time. The tiger's behind us, we gotta get out of the forest, right?
Yeah.
And so similarly, the body reacts by saying, okay, right now is not the time to let the poop out. We're gonna hold it in, we're gonna constipate.
Hi, everyone. Welcome back to the channel. Today, I am talking to Dr. Kumkum Patel. She is a board certified gastroenterologist. She is a gut motility specialist, and she also treats a ton of IBS patients. Today, we're going to talk about all the myths related to IBS because it is such a complicated subject. And I'm really excited for her to drop some serious knowledge in this interview. And thank you for being here, Dr. Patel.
Thank you so much for having me. It's an absolute pleasure.
Okay, let's get into it. So what is IBS, just to get a lay of the land here?
Absolutely. So IBS stands for Irritable Bowel Syndrome, and it's really a chronic condition. It's actually now considered a disorder of gut-brain interaction. So it's really important to know that it's actually been defined as that. And it's happening because there is something abnormal that the brain is telling to the gut that the gut is now responding with abdominal pain, changes in the bowel habits, and change in the frequency of the bowel habits themselves. So the character and the frequency of bowel habits are changing, and it's accompanying abdominal discomfort and abdominal pain. And that is what is IBS. Now, the causes of IBS are what is very complicated, very multifactorial, and very poorly understood. And that's why I think that IBS is such a complicated disease.
So medical professionals also call IBS a diagnosis of exclusion. Can you explain to our audience what that means?
Yes, absolutely. So whenever a patient comes in and says, I'm having certain symptoms, the most important thing for a doctor to do is to make sure that the worst possibility is not what's happening, which is a malignancy, a cancer, or something that is a surgical emergency. So now let's say you're coming and you're having abdominal pain or a lot of diarrhea. If there's blood involved or some abnormal laboratory findings are there, those actually take priority in evaluating to make sure that something such as cancer or a bleeding or an infection is not taking place at the time that you're complaining of those symptoms. Once those are eliminated, or we've ensured that you're not having a malignancy, a cancer, or something else more significant happening, then we can say, okay, what else could it be? Could it be that this is a manifestation of a disorder of the gut and brain interacting, or is this because there's an actual abnormality in the lining of the intestines that's causing this to happen?
Okay, so I have a personal question. I don't know if I would like to let the world know about it, but here goes. So I am very fixated about going to the bathroom in the morning.
Okay.
And it really bothers me if I cannot go to the bathroom in the morning, like if I cannot have a bowel movement in the morning. Is that IBS-ish, or is that just, some kind of, personal idiosyncrasy that I have?
Well, so here's the thing. We defined normal bowel movements as anywhere from 3 times a day to 3 times a week. Okay, so you can have a bowel movement every other day, and that's considered normal as long as it's normal for you. You can have it up to 3 times a day, and it could be normal for you. What makes it normal is what the actual poop looks like. So every time you poop, if a Snickers bar, what we call Bristol stool type 4 stool, is coming out, then it's normal. But each time if you go to the bathroom, now if you've got watery diarrhea, oatmeal, it looks like chocolate milk coming out, that's not normal, right? So the frequency and the character of what it looks like is far more important than, what, is considered in terms of it coming out.
Is fixation on going to the bathroom, is that within the realm of normal, or is it only abnormal if it's like disruptive to your life?
A little bit of both. If you're fixated on having the bowel movement, that could actually perpetuate a vicious cycle of visceral hypersensitivity, because now your brain is under distress thinking about when you're going to have the bowel movement, why you haven't had it yet. And sometimes your body can go into a low dose fight or flight mode, where it's like, okay, well, I need to have it. I need to have it. I'm thinking about it. I need to have it again. And now it's 8 o'clock. Now it's 8:05. I have to get to work by 9 o'clock. It needs to happen now before I get into the car, because if I get in the car, now I'm going to be stressed out. That stress response in itself can trigger IBS, because what it does is actually tells the nerves in the gut, the enteric nervous system, okay, we're either going to freeze or we're going to hold all the poop in which case people have IBS type C, which is constipation, or the opposite happens, where people's intestines are like, you know what? We are too stressed out. We need to be empty. That means the minute food hits it, we're going to evacuate it. We're going to empty out our bowels. So people end up having diarrhea, or they get nauseous and they get bloated and they want to vomit. So people can have one or two responses, but both of those are responses to underlying stressors, whether it's psychological or whether it's a physical stressor that's there.
All right, that's really interesting. And that makes a lot of sense when you're talking about the brain and gut axis and how they're related. So can you explain a little bit more about how the brain gut axis is related?
Yes, absolutely. So the gut and brain axis is connected through something called the vagus nerve. It's one of the main nerves in our bodies. And the central nervous system, that's where our brain is located, is communicating with the enteric nervous system. That's the nerves in our gut through the vagus nerve. The gut is actually called the second brain because it is responsible for making a lot of our overall health and hormones. So the bacteria in our gut are responsible for making something called neurotransmitters. These are brain chemicals, okay? So you think about your happy hormones, your serotonin, your dopamine, your norepinephrine. These are your happy hormones. And a lot of our gut bacteria are actually what's responsible for making these types of neurotransmitters. These neurotransmitters then travel from the gut to the brain via the vagus nerve and then help set our mood. So if you're in a state of distress, your gut bacteria are not having enough chance to make those happy hormones, which then perpetuates the cycle of feeling more stressed because those happy hormones aren't traveling to your brain, and you get in a state of not feeling well, becoming depressed, becoming anxious. Conversely, if you're stressed, the brain is telling them, okay, we're in a state of stress. Let's alter how we perceive pain. Let's alter how we move our bowels. Let's alter how we let toxins in. So all these factors kind of work with one another and are actually taking part in the gut-brain axis.
That's super interesting. That's also maybe why I just did an episode on IBS and cannabinoids and potentially how cannabinoids can help IBS patients, and it's being studied right now. I'm guessing that that has to be all interconnected because we have the endocannabinoid system as well in our body.
Absolutely. So there's cannabinoid receptors in our brain, in our gut, and we don't know completely. We're learning about how they function. To some degree, it alters the motility. So in some people, it will allow for things to relax, the intestinal muscles to relax. And for some people, they need that in order for their bowels to empty. For other people, it causes for more of contraction, which means that their poop can move along easier. Endocannabinoids can also help with the release of serotonin, which is our happy hormones. And we know that serotonin is very intimately involved in moving our gut, right? And so you see that in a lot of people who have constipation, they need that serotonin. They need those happy hormones to get our poop moving along. So in a lot of IBS-C patients, we actually give them serotonin drugs like Zoloft or sertraline so that it can actually help with their IBS and it can help with their mood.
I love that. If anybody's actually watching this and not just listening, Dr. Patel likes to show us how the poop is moving along the gut. That's what I'm going to tell my toddler. I'm like, I need you to poop in the toilet.
That's what I do for my toddler. Actually, I'm like, okay, we have to get it to move along.
Okay. You need to hurry up and poop because we're late for school.
Yes.
No, that's not what you're supposed to say. You're not supposed to say that to your toddler.
That will cause anal retention, actually.
Yeah, I've watched a lot of videos on what you're not supposed to say during potty training, and that's one of them. So don't listen to that. All right, now I want to start fact or fiction when it comes to IBS. So, fact or fiction: women have more IBS than men.
Irritable bowel syndrome is seen in almost 2.5 times much more in women than it is in men. And that's because we have a higher perception for pain, higher changes in our hormones, which are associated with changes during our menstrual cycle, which exacerbate our IBS symptoms. We're also more likely to experience bloating, abdominal pain symptoms throughout our lifetime. And so, yes, we see a lot more IBS in women than we do in men.
And what's the typical age that you start seeing IBS in women? When do they typically present?
So usually it starts in their late teens, early 20s to like their mid 40s or so. This is like the largest population of people who have IBS. So about 15 to 45, I would say, is that age range. And that makes sense because just around then is when you're having some major hormonal changes, right? You're hitting menstruation, then you're hitting motherhood. And after that, you're hitting closer to perimenopause and menopause, all three major life changes of hormones in a woman's life cycle. And they are associated with changes in our gut microbiome, which is then changing our symptoms for IBS.
Okay, fact or fiction, omeprazole can help with IBS.
Ooh, this is a complicated answer because you can't just answer it as a fact or fiction. If you're truly having irritable bowel syndrome, then that actually does not relate to reflux, which is what omeprazole is used for. So if you're having reflux symptoms and it's true acid reflux that you're having, and excessive acid reflux, then omeprazole can actually help with GERD, that's what it's called. GERD is not an IBS symptom. If you're having GERD, which is gastroesophageal reflux disease, that's an actually separate entity itself. IBS actually has to do with lower GI symptoms because it has to do with your bowel movements. So omeprazole affecting IBS symptoms are not completely related. What PPIs, that's the class of medication that omeprazole is in, can exacerbate IBS symptoms because PPI, as a class of medications, can cause something called microscopic colitis. This is where the lining of the actual colon can become irritated, and it can alter the lining of the colon. That can lead to a light form of diarrhea or loose stools. And so a lot of people's IBS symptoms can get exacerbated when they start PPIs. So does it make it worse? Only if they're getting microscopic colitis. Can it make it better if it's actually treating GERD? Yes.
Hi, everyone. If you've enjoyed this interview thus far, be sure to hit the like and subscribe button below. It not only helps the channel, but helps out all the people that we interview. Thanks for watching. Fact or fiction, alcohol makes IBS worse?
Fact. Alcohol changes our gut microbiome and it can cause intermittent changes in the lining of our stomach and our intestines. And by disrupting the gut microbiome, it can exacerbate our IBS symptoms.
And how much alcohol is that? Like a glass of wine or getting trashed?
I think there's been new studies that have come out that show that even one glass of wine can be enough to cause a change in your microbiome. So really, no alcohol is a good amount of alcohol. Now, can you drink this in moderation and make sure you're supplementing with good foods that are high in fiber? Yes. Am I going to tell you to completely give up alcohol? I can't do that. It's so ingrained in part of our society that if you're going to do it, know that it comes with detrimental effects. Know that the consumption of alcohol will cause a change in your microbiome. That affects different people in different ways based on what their underlying microbiome already was.
Fact or fiction, there is a cure for IBS?
Ooh, fiction. There's no cure for IBS because IBS is an ongoing, lifelong condition that is defined by the disorder of the gut-brain interaction. So if you have irritable bowel syndrome, you're targeting the symptoms of it and the underlying root causes of it. And if at any time any of that changes, your IBS symptoms can return, right? So it's not that you're cured of it once you go on a good diet if you're having a lot of psychological stressors or physical stressors, right? Or it doesn't go away because you took a certain antibiotic and killed off a lot of bad bacteria. If you had a repeat bout of illness or you had a repeat bout of binge drinking. So all of those things can cause it to come back.
Okay, fact or fiction, probiotics are helpful for IBS patients?
It's not as black as white, it's more gray. Probiotics have been known to help in terms of alleviation of IBS symptoms. There's no one silver bullet probiotic, and there's no one single formulation that is considered the gold standard, because there's a lot of studies being done currently in terms of what is helpful. We know that certain strains of bacteria are more helpful in terms of alleviation of IBS symptoms because they are known to produce more brain chemicals, to help the intestinal lining stay appropriate, to help prevent permeability, to help make more of those happy hormones. But there are other detrimental bacteria as well. So can probiotics help? Yes. Is there one silver bullet probiotic out there? No.
Fact or fiction, coffee is helpful with IBS.
So coffee is complicated. Coffee contains caffeine and also contains something called chlorogenic acid. So coffee, when it contains caffeine, can exacerbate your IBS symptoms because what the caffeine does is causes cramping of our intestinal muscles, right? So that intestinal motility is then triggered by caffeine. But in some people who have IBS type C, that could be very helpful because that caffeine can almost cause a trigger of movement. So hot liquids and coffee in the morning, first thing, can actually trigger peristalsis in your colon muscles, which is great for people who've got constipation because it moves it along. In people who've got diarrhea normally, it may make them feel a lot worse because that caffeine and that warm liquid is then triggering that same peristalsis, which can be too much in someone whose bowels are already going like this, right? So you don't necessarily want that. But now you think about it, coffee is helpful because it has something called chlorogenic acid. That's one of the main compounds, one of the main antioxidants that's in black coffee itself. And that can actually help the health of the colon cells themselves because it helps in terms of keeping the lining healthy and keeping the lining making good barrier function. So coffee in itself is not bad. It's healthy for you. What it does to your IBS symptoms, it's very dependent on the person itself.
And also it probably depends on amount, right? Like we don't want people drinking like 10 cups of coffee a day.
Correct. The more coffee you have, the more caffeine it contains, unless you're having decaf, in which case you're just getting the benefits of the chlorogenic acid. But the caffeine is what is the motility issue, right? And so if you have diarrhea underlying, or you've got soft stools, or you get a lot of cramping normally, drinking coffee can exacerbate that. So be aware, right? If you're needing caffeine from something else, then, use exercise to kind of promote endorphin release so you're kind of more awake instead of relying on caffeine.
Okay, fact or fiction, walking can help you poop.
Absolutely fact. Because walking actually triggers for intestinal motility to happen. So moving of your skeletal muscle will cause moving of your smooth muscles in your body. And it also actually helps for good bacteria to allow them to ferment and make more healthy bacteria to make more happy neurochemicals.
But what about running? Is running gonna like constipate you?
It depends. So in running, if you're running away fast and you're in a state of stress, in the active form of running, you will not poop, okay? Because in the active state of running, your body is like, okay, we are in a fight or flight. Literally, we're running away, right? Because our bodies are primordially inclined to say, okay, I'm in a forest and there is a tiger behind me. I must run and get away before tiger eats me. So when you are running, in the active state of running, you are not supposed to eat or poop, right? Nothing goes in, nothing comes out, because those are rest or digest states of being, or parasympathetic states of being. So in the active act of running, you will hold it all in, okay? In some people, right before they run or right after they run, they may experience diarrhea because the body's like, okay, we're done running, the tiger's gone. And then the muscles can actually relax to let it out.
That's really, yeah, that's true. You don't want to have to poop if you're running away from a tiger.
But that's the underlying brain mechanism that our bodies go into, right? You're in the middle of a race, you're trying to get away from the tiger. We're in a sympathetic response state. We don't activate our rest and digest. Like right now is not the time. The tiger's behind us. We got to get out of the forest, right?
Yeah.
And so similarly, the body reacts by saying, okay, right now is not the time to let the poop out. We're going to hold it in. We're going to constipate until we're relaxed.
That's how those surgeons that we know do like 20-hour surgeries because they're just like holding it.
Or they wear diapers, which I don't. Yeah. Yeah. Some of them
Oh,
wear diapers, but
well, that's true. I mean, 20 hours operating. I mean,
yeah.
you gotta pee.
Yeah, you gotta pee. You gotta pee.
I mean, you gotta pee. Forget poop, you gotta pee. Fact or fiction, bananas help IBS.
Oh, this is a good one. So bananas have unripe bananas are considered low FODMAP. Now, this is really important to understand because fruits and vegetables have fiber in them, okay? And fiber is this insoluble macronutrient that we take to kind of move our body along and to feed our bacteria. The FODMAP foods are fermentable, naturally occurring sugars that are in our fruits and vegetables. So an unripe banana has low fermentable sugars. A ripe banana has a high amount of fermentable sugars, okay? So if you eat a low FODMAP or an unripe banana, that is tolerated better in people who have IBS because that those fermentable sugars are not, there's not a lot of them, so they're not breaking down in our colon as easily, and therefore not causing that bloating or that IBS symptom. In ripe bananas, because it has a lot amount of that fermentable sugar, because it does not get digested well in our small bowel, it goes and ferments in our colon, and that causes a lot of gas to be trapped, a lot of water to be pulled, and that's what causes a lot of the IBS symptoms to get triggered. So you get more bloating, and in some people, you get a lot of diarrhea. So if you're gonna eat a banana, it's gotta be a small amount, and if you're one of those people who needs to poop because you're constipated, then sure, bananas can help. But if you're someone who is on the diarrhea side, having an unripe banana may be your way to go.
Okay, fact or fiction, pregnancy makes IBS worse.
Ooh, it depends on the type of IBS you have. So with pregnancy, you have a change, major change in hormones, right? You've got a lot of progesterone maintaining that baby, right? And progesterone usually slows down your motility of your gut. So you've got a lot more constipation happening because things are just not moving along as easily. So in people who have IBSD normally, they may feel great because for the first time, their bowels have slowed down. In people who are constipated, they can feel a whole lot worse because now the progesterone has really slowed down their bowels. And so it's important to get fiber into your diet, especially if you know you're on the constipated side, because you want that bowel to move and that progesterone is going to slow down your motility.
This was super interesting. We could go for hours talking about fact or fiction when it comes to IBS. So we'll have to have you back to do some more of these. What are your top 3 tips for patients who do have IBS and are suffering from this condition?
Absolutely. So I would say number one, get fiber in. The ADA recommends that everyone get in anywhere between 25 to 38 grams of fiber a day. And so fiber is what our bodies and our bacteria need to eat in order for them to do our job. So it's much like a car. You need to give it fuel or electricity to run. We need to give our gut bacteria fiber for it to work properly. Number 2, get sunlight or natural light every single day. Our bodies run on a clock or a circadian rhythm, and getting the sunlight is actually going to tell our brains that it is daytime and we need to work and move things along. And then when we go to sleep, that it's nighttime, it slows down. So getting a natural light can help actually get that gut bacteria to produce its happy hormones and set its biological clock. And number 3, get 7 to 9 hours of sleep. Sleep is extremely important. A lack of sleep is known to cause a disruption in your gut microbiome, in the healthy bacteria that's there. Even 36 to 48 hours of poor sleep can alter your gut microbiome. So get a good night of sleep. That's going to allow for your body and your bacteria to rest, recharge, and make those happy hormones so you can continue functioning at your optimal self.
What about water? What's your opinion on water?
Absolutely. You need to hydrate. Your colon is the main place where we absorb all of our water. And that is where we need to make sure we are giving ourselves the hydration that we need to survive and to keep everything flowing well.
Awesome. And I know you have a private practice in Southern California. So can you give us a little bit more information and where patients can find you?
Absolutely. So if you're in the state of California, you can make an appointment to see me via telehealth or in person. You can go to my website, www.kumkumpatelnd.com. If you're not in the state of California, I still offer educational and wellness visits or second opinion consultations for everyone nationwide and worldwide.